Today we will discuss about the floor of the fourth ventricle. Before we start the floor of the fourth ventricle, I will give you the introduction about the brain, part of the brain. Here you can see this is the lateral view of the brain, and here you can see this is the frontal lobe of the brain, this is the parietal lobe of the brain, this is a temporal lobe of the brain, this is the lateral sulcus, and here there is a central sulcus which is lies anterior to the this is a lateral central sulcus, and this central sulcus, in front of the central sulcus, it is called the frontal lobe. Behind to the central sulcus, this portion between the parieto-occipital sulcus and central sulcus, and above to the lateral sulcus, this portion, it is called the parietal lobe, and behind to the parieto-occipital sulcus and parieto-occipital notch, the area behind to it, you have to draw the line behind to it, it is called the occipital lobe, and below to the lateral sulcus and in front of the parieto-occipital notch, you have to draw this line, it is the temporal lobe. So today we will discuss about the floor of the fourth ventricle. This is the cerebellum and this is the brain stem. Here we have got the cerebellum as well as the brain stem. The floor of the fourth ventricle, which is the tent-like cavity of the hindbrain, and hindbrain, it is the here you can see I will cut the cerebral peduncle, and here you can see this is a cerebral peduncle. It is formed by the cross cerebri as well as the it is formed by the cross cerebri. This is the anterior portion, it is a cross cerebri, and posterior portion, it is called the tegmentum. And we have removed cut the cerebral peduncle, and the posterior part, it is a two colliculi, superior colliculi and the inferior colliculi, it is called the tectum of the midbrain. So the basically in cross-sectional view, the midbrain is divided into the three parts. This is the cross cerebri. Behind to the substantia nigra, this bluish coloration, here you can see this is a bluish colorations. It is the substantia nigra. Behind to it is called the tegmentum, and these are the four colliculi behind to the central canal portion, it is called the tectum of the midbrains. Now we will discuss, and here you can see this is the pons, and this is the medulla oblongata, and this is the pyramid of the medulla oblongata, this is the olive of the medulla oblongata, this is the inferior cerebellar peduncles. Between the olive and pyramid, there is a emerging of the hypoglossal nerve. Between the olive and lateral to the olive, there is a 9th, 10th, 11th cranial nerve. This is the 5th cranial nerve. Between the pyramid and pontomedullary junction, 6th and 7th cranial nerve. Between the pons and medulla olive, it is the 8th cranial nerve which is emerging. And between the interpeduncular fossa, here there is emerging of the 3rd cranial nerve and the 4th cranial nerve which is emerging from the posterior side at the level of the inferior colliculi. This is the 4th cranial nerve, it is the trochlear nerve which is emerging from on the dorsal aspect. So now we will discuss about the floor of the fourth ventricles. It is the tent shape cavity. It is the tent-like cavity inside the hindbrain, lined by the ependyma and filled with the cerebrospinal fluids. Situation, it is lies behind to the pons. Here you can see this is the anterior part of the pons, it lies behind to the pons and behind to the upper part of the medulla. So half of the floor of the fourth ventricle which is lies behind to the pons, and half of the portions which is lies behind to the upper part of the medulla, and it lies in front of the cerebellum. It lies in front of the cerebellum. It is a triangular in outline in sagittal section. If I will take the sagittal section, it is a triangular in shape, roof. It lies on the posterior aspect which is formed by the superior medullary velum and inferior medullary velum. It is communicated with the superiorly, it is communicated with the cerebral aqueduct, and inferiorly it is communicated with the central canal. This is the inferiorly, it is communicated with the central canal. Boundaries of the floor of the fourth ventricle include the lateral boundaries, roof and floor. Here this is the lateral boundaries, So the lateral boundary, which is bounded by the on each side superolaterally by the superior cerebellar peduncle, infralaterally by the inferior cerebellar peduncles, and it is completed by the gracile and cuneate tubercle on the infralateral side, and on the lateral side there is a medial cerebral peduncles. The floor roof of the fourth ventricle, which is formed by the here there is a superior medullary velum, and on the inferior aspect there is an inferior medullary velum. So floor, which is formed by the two things you have to remember: the portion of the superior cerebellar superior medullary velum. On each side it is connected with the superior cerebellar peduncle, this superior medullary velum. Inferior medullary velum, here it gives there is a two opening on the lateral side, and the medially it gives the one opening, and the lateral opening it is called the foramen lusca, and here you can see here this is a foramen lusca, and the medial opening it is called the foramen megendi. So through these three openings, foramen megendi into the midline and the foramen lusca on each side, there is a CSF which is escape, and it goes inside the subarachnoid space, and it is circulated, and it enter inside the cerebellomedullary cistern, or it is called the cisterna magna, and this absorption of this CSF by the arachnoid villi and granulations. You have to remember the superior medullary velum, which is the white fibers which is connecting to the thin white fibers which is connecting on its side to the superior cerebellar peduncle, while the inferior medullary velum, which is not a nervous tissue, it is the, you have to remember, it is the ependymal and the pia mater which is lined the inferior medullary velum, and there is a three openings inside the inferior medullary velum. There is a two on each side, there is a foramen lusca, and the middle aperture it is called the foramen megendi. Now we will discuss about the floor of the fourth ventricles. The floor of the fourth ventricle, it is formed by the posterior surface of the pons, upper portion it is behind to the pons, and lower portion it is lies behind to the upper part of the medulla oblongata. So it divide it is the diamond shape. Here you can see it is a diamond shape, and the upper triangular it divide into the two part by the upper triangular area and lower triangular area by the white glistening fibers. It is called the stria medullaris. The stria medullaris, which is the fibers which is emerging from the median sulcus. This is a median sulcus. It divides the floor of the fourth ventricle into the right and left half of the floor of the fourth ventricle, and stria medullaris, which is emerging from the middle of the it is a glistening fibers which is coming from the median sulcus. It is the inner side, there is arcuate fibers, and it is merged inside the inferior cerebellar peduncles. This is the inferior cerebellar peduncle. So this is a white glistening fibers which is coming from the midline, or it is called the median sulcus, and it is merged laterally with the inferior cerebellar peduncles. Entire floor, which is divided into the two part by the median sulcus. Lateral to the median sulcus there is one groove, it is called the sulcus limitans. This is called the sulcus limitans. So lateral this is the median sulcus, and there is a laterally one groove, it is called the sulcus limitans, and in between the median sulcus and sulcus limitans there is a elevated area, it is called the medial eminence. It is called the medial eminence. Just above to the stria medullaris, this is the stria medullaris. Above to the stria medullaris there is a one elevated area, it is called the inside the lower part of the above to the stria medullaris and lower part of the medial eminence. This is the elevated area. It is called the facial colliculus. It is called the facial colliculus. So this facial colliculus, which is due to emerging of the facial nerve, which is wind around to the abducent nucleus, and it is called the internal genome of the facial nucleus. This is a facial colliculus. It is elevated area due to the facial nerve, which is wind around to the abducent nerve, and it is called the internal genome of the facial nerve. Now, just lateral to the facial colliculus, there is a depressed area. It is called the superior fovea. This is the depressed area. It is called the superior fovea on its sides, inside the sulcus limitans, and above to the sulcus limitan, superior fovea, there is a bluish discolorations. There is a bluish discolorations. It is called the ceruleus. It is called the locus ceruleus. This bluish coloration, it is called the locus ceruleus, and this is the nerve cells containing the melanin pigments, which constitute the substantia ferruginea. Lowermost part of the sulcus limitans present a small depressed area. Here you can see this depressed area. It is called the inferior fovea. From the inferior fovea, there is a oblique line which goes towards the median sulcus, and it divides the two part of the inferior part. Medial part, it is called the hypoglossal triangle. This portion, it is called the hypoglossal triangle, and lateral portion, it is called the vagal triangle. It is called the vagal triangle. So this is the vagal triangle, and this is a hypoglossal triangle. And lateral to the sulcus limitans, this area, portions of the lateral to the facial colliculus as well as above to the stria medullaris, the lateral area, it is called the vestibular area. And beneath to it, there is a floor of the fourth ventricle. There is a vestibular nuclei which lies under beneath to it. So lateral to the sulcus limitans, there is a area above to the stria medullaris. This is the stria medullaris. Above to it, this triangular area, it is called the vestibular triangle or vestibular area. So here you can see this is the inferior fovea, and just there is one reads from the sulcus limitans. Medial to it, this triangle, it is called the hypoglossal triangle, and lateral to it, it is called the vagal triangle. The hypoglossal triangle, which is further divided into the two part by the faint oblique reeds. Into the medial part, it lies under beneath by the hypoglossal nucleus, and the lateral part, it under beneath there is a nucleus intercalatus. The inside the vagal triangle, there is a oblique reeds. This oblique reeds, it is called the funicular separations, and this funicular separations, area below to the funicular separations and above to the gracile tubercle, this area below to the funicular separations and above to the gracile tubercle, the area, it is called the area postrema. And between the below to the funicular separations and between the two gracile tubercles, there is a portions of the floor of the fourth ventricle. It is the obex, and from the just deep to the obex, there is a central canal which is started. The inferolateral margin of the fourth ventricle, it marks by the narrow white reeds. It is called the tinea. Here you can see this is the tinea. The both sides of the tinea, right and left tinea, the meeting points at the floor of the fourth ventricle, it is makes the obex. It is just above to the gracile tubercle and below to the funicular separations, or below to the area postrema, there is a formations of the obex. So inside the specimen, here you can see this is a tinea, and the both side of the tinea which is meeting, it is called the obex. And just deep to the obex, there is a central canal which is started. Here you can see this central canal which is started. And you have to remember, there is a clinical aspect of the floor of the fourth ventricle tumor which is occasionally occurs, and mainly it is the ependymoma or medulloblastoma, which is a very rare tumor which is occur inside the floor of the fourth ventricle. And the medulloblastoma, it is highly malignant and produces sign and symptoms of the cerebellar lesion, because the cerebellar which is lies behind to it, and it plays the vital center located beneath to the floor of the fourth ventricle. You have to remember mainly the vagal vagal nucleus, glossopharyngeal nucleus, hypoglossal nucleus, as well as the spinal accessory nucleus which is lies. So this is about to the floor of the fourth ventricle. Hope you enjoy the lecture. Thank you very much.